Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Please do not message or call, as the following programme is a rerun of a previous live show. Any announcements made during the repeat may now not be applicable.
Assalamu alaikum to all the listeners and viewers. I welcome you to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. We will be hearing some kind of a we will be hearing. We will be getting some kind of a snow. As I will, there are so much news and hyped up about the weather conditions and the emergency services on that. So just be very, very careful and look after yourself, because yes, the cold is not good sometimes. This program is broadcasting live from the studios of Inspire FM today on Thursday, 31st of January 2019, and casting its positive vibes to all our lovely people in Luton. Our positive vibes going all across Luton, like Dunstable, Harpenden, Bedford, and our airwaves reaching all across through different parts of the world from our website, which is if somebody is listening through Inspire FM website, or you can view us live from Facebook live page. If you do not know how to go to it, just go to Facebook page and search for Inspire FM Luton and click the link and you can see us. We're also, you can listen back to us on Spotify, iTunes and Podcast under the Health and Fitness Show page. If you're listening to this show on Sunday or any other Thursday, that means it's repeat. But hey ho, today it's not, because it is 31st of January 2019. Yes, I always start my show with a positive quote. So today's positive quote goes something like this: "We must embrace pain and burn it as fuel for a journey for our journey." And one of the other quote is, "Cancer is a word, not a sentence." Yes, I must say you may have understood that we are talking about cancer. So without any further ado, let's go to our topic, which is cancer awareness. And yes, you have heard me correctly. We are talking about cancer awareness. I know some of you must be thinking, oh yes, cancer awareness, we know about cancer. What's something new about it? But hey ho, there are people who are suffering, and today's show is basically kind of a benchmarking onto the World Cancer Day, which is happening, the World Cancer Day, which is happening on Monday, 4th of February. And sometimes it's always nice to know what sort of problems we may be facing, and how can we keep ourselves aware and safeguard ourselves with different cancer-related issue. But I'm not the one who will be talking about it all the time throughout the way. Joining me today in the studio at the moment is Elizabeth Bailey from Public Health Luton, but I will ask her to introduce herself and tell us about her.
Hello, good evening, everyone. Thank you for inviting me along. And I must apologise, my voice is a bit croaky this evening, but I'll do my best. As Fahad says, I work for Luton Borough Council Public Health Team, where one of my responsibilities is community education and awareness around cancer. But apart from that, I'm also a 9-year breast cancer survivor myself, so I have a personal story. And also, for most of that 9 years, I've been what's called a campaigns ambassador for the charity Cancer Research UK. So I've been engaged in political lobbying around cancer, and by that I don't mean party political lobbying, but basically campaigning for changes in public policy that will aid cancer prevention, awareness, understanding and treatment. So I'm a bit of an amateur cancer buff.
Well, it's better than nothing, and I must say, and yes, I really liked it when you said I'm not politically campaigning, because it will contradict the work you do in public health.
Oh yeah, I can't. Yes, exactly. Yes.
But yeah, it's always nice to have you, especially as a person who's involved in cancer from the professional point of view and as a personal point of view. And definitely we like to know a bit more about the whole thing, and definitely we will be talking about it throughout the length of the show. Our second guest will be joining us shortly. Will be Claire Copleston and Regita Avantage from Meaningful Educations, and they are also informing us about the dignity side on the cancer campaign. Also, shortly joining us on the phone will be Dr. Anitha Bholthar. She's a GP and a cancer lead from Luton CCG. So let's. But definitely, I like to involve our listeners. So listeners. If you have any questions or queries regarding our show tonight, please do get in touch with us. Do give us a call on our telephone numbers, which is 01582 481822. I repeat, 01582 481822. Or you can send your questions via text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. Now, it is really nice to have people like Elizabeth among us, because for her it's twofold thing. She's a cancer survivor as well as a person who knows and who preach about this disease. So let's start by asking Elizabeth about cancer. So Elizabeth, or shall I say Lizzie?
No, I'm Elizabeth, or Betty, if you like.
Betty. So Betty, tell us, what is cancer?
It's essentially, it begins with cellular level damage, genetic damage. And often this damage is fought off by your own body's immune system, but sometimes it isn't. And it establishes itself and creates sort of mutant cell formations that don't follow the usual rules of cells of being born and dying, but they become immortal in a way and grow in an uncontrolled way, and that's why you get things like tumours and lumps. And it's dangerous because certain types of cancer can break away from their original site and travel around your body and establish themselves in other parts of the body where they can do very profound damage and, in fact, cause severe illness or indeed death. So one of the things about cancer that's very interesting is that while it's spreading through your body, it continues to mutate genetically, if people sort of understand what that means. It's continuing to outwit your body as it travels around it. The science of it's very fascinating, but, a little bit worrying.
And, well, on a layman terms, I have been told, and please rectify me, it's a common, either it might be a misconception or might be a knowledge given by people, is that cancer is something which stays dormant in our body and become active once we died. Is that?
Well, It really does seem to be the case that a lot of genetic mutations are fought off by your immune system, but they can lie dormant in your body for many years. And for example, breast cancer, you can have breast cancer and be free of it, go through the treatment process, be free of it for maybe 20 years. And as you get older and your immune system begins to fail, it can come back many years later, unfortunately. If the tiny microscopic cells that have travelled around your body reawaken and your body's not fighting them off. So we all have this genetic damage going on in our bodies all the time, and it's caused by environmental factors and lifestyle factors and many other things. And it's more a case of sometimes it gets out of control and your body can't keep it down. And that's how cancer establishes itself. And it is very, very fascinating science. If you ever have a chance to go to a Cancer Research UK laboratory, please take that opportunity because it's fascinating.
I will definitely, I will. And it is something which I will definitely look into it in detail-wise because I was, as you know, my daytime job is with the health sector. So when I was involved in cancer program, yes, I was being offered, but because of my availability, I did not manage to make it. But yes, definitely, I will take that. Let me introduce our other guest who just joined in today in the studio, and I'll let them introduce themselves. So, hello, girls.
Hello. Fahad.
Sorry for our lateness.
Sorry for sneaking in as well.
No problem. So introduce yourself, please.
I'm Roberta, and I'm a director at Meaningful Education. We're a mental health organisation, and also one of the founders at the Bedfordshire Dignity Network.
And I'm Claire Copleston, and I'm also one of the founders at the Bedfordshire Dignity Network and a director at Meaningful Education.
Perfect. Good evening, girls.
Good evening.
Thank you so much for coming for our show tonight, and it is nice to have you guys because you guys are also doing an event on dignity
tomorrow.
Yes.
Yeah.
National Dignity Action Day.
Yes. What is that?
Well, National Dignity Action Day is a kind of day to represent organisations, people in the community, carers, healthcare professionals to come together to promote and raise awareness of how we can preserve dignity within care services, within the communities. And it's led by the Dignity in Care campaign, which is kind of run by the National Dignity Council.
Okay. So in cancer, how dignity involved in cancer care?
I think it comes down to about how you engage with somebody. For instance, I was just kind of listening to your lovely self.
Elizabeth.
I know, yeah. So I was listening and I was thinking about dignity and the cancer patient experience. And I actually was a carer to my own mum who had breast cancer. And I feel that, it was quite important to preserve my mum's dignity because she had breast cancer, it's in quite a private place as well, isn't it?
Sure.
And I think it's about for her, I think it was about having choices and being treated with dignity and respect and having sensitivity when approaching, the topic and talking about it, and I think it's about having choice in your own care as well. So it's about your privacy and your choices, and everything has to be kind of put into a person-centred approach in enabling the person to preserve the dignity of that individual as well.
I think you go on to ask about in your questions to ask about screening, and one of the big barriers for people attending cancer screening is embarrassment or body taboos. And so this business about dignity is really, really important to get people to engage with essential services.
It is. And I also think as well, sometimes you can feel like your dignity is really impacted because, you go into an unfamiliar environment and, we're poked and prodded and we have to have these x-rays and we're pictured. We're asked to, remove our clothing and placed in a gown. And that's if the gown even does up, and sometimes it's really undignified, but, we know that it's for our best best interest, and we know that we have to, go through with the tests and the procedures, but sometimes it's just about, trying to preserve somebody's dignity as best as we possibly can in those situations.
The fact is, the three national screening programs for cancer involve intimate examinations of the breast, bowel or cervix, and some people find that very difficult to deal with.
Yeah,
indeed, and sometimes it's the cross-gender examination is also very awkward when you're a female and you've been examined by a male.
You can ask for somebody of the same gender.
We are lucky in a sense in Luton Dunstable that all the breast cancer specialists are female doctors.
Well, I think we've got a mixture, but you can ask for...
okay.
You can ask... If you want somebody of your own gender, you can ask for that.
Oh, right, okay. Yeah, that's definitely a good thing to have. Otherwise, it's really hard when we do all those things. Anyhow, let's move on in terms of prevention side. I know cancer is a very dangerous disease and illness. So is there any way we can prevent cancer?
You can't totally prevent cancer. What you can do is considerably reduce your risk, because we reckon about 40% of cancers are lifestyle related. And the best ways to avoid cancer are not to smoke. That's the absolute silver bullet.
No.
I mean, it's just such a silly thing to do. To anybody listening, we've got lots of services to help you if you smoke. That's the biggest risk overall. Next up is obesity, being overweight. Now, people are a bit bamboozled by this. And I think often it's because they don't understand that fat is not something inert that lies in your body and does nothing. It's actually a very active chemical factory. And it has a lot of effects on your hormones, and the hormones are very influential in the growth of cancer. So that's one of the reasons. Being overweight is a risk. Another really good way of preventing cancer is to get the HPV vaccine. That prevents several cancers, including most cervical cancers, cancers of the rectum or mouth, a number of cancers that are transmitted by the HPV virus. And that's currently available to teenage girls. So I really would encourage people to get their teenage daughters to have it. Mine are having it. We'll shortly be giving it to boys as well, but at the moment you can pay to have your sons vaccinated. It's about £300, which is a bit much for a lot of us, but you might consider it worth it for the well-being of your child. But there will be a government programme in due course. But most of the best advice is standard healthy lifestyle advice, so keeping your weight down, not smoking, moderate consumption of alcohol if you drink, because that's implicated in a number of cancers, and taking exercise, because exercise, there is a link between being physically fit and exercise in preventing things like cancer recurrence statistically. Well, it's hard to explain all the mechanisms, but it might be related to things like weight control.
Now, I'm fascinated in terms of the weight control part, because people do, and I absolutely understand it baffles people, especially baffled me on the other day when I read that being overweight is now the most common reason for getting cancer.
It's the second most common reason. Smoking's still the king.
It's still the king. Well, wow. Yeah. Even cigarettes are getting expensive. It's still the most common reason. Wow. So I was completely baffled when I heard about it, and I was thinking why, and then I realized, yes, when you're overweight, you automatically start moving less, which automatically created more problems, and then you slowly and gradually going towards the long-term conditions, health conditions. Well,
it's more that, as I say, fat's an active substance. It's not just lying there. It's doing stuff chemically. And, for example, the majority of breast cancers that women get are what we call estrogen positive. They feed off female hormones. So you might have the genetic damage in your breast to start with, but what makes the tumour thrive and grow is a diet of estrogen, which is the most common female reproductive hormone. So fat stores estrogen very well. And I'll tell you something else. In men, fat can more or less convert male hormones like testosterone into something very similar to estrogen. So it alters them chemically. So you've got this little factory in your body producing stuff that can do you quite a lot of damage. So that's one of the reasons we understand that it's important.
Mm-hmm. I remember one of my GP friend, Dr. Taliba Babakar, said that our bodies are made to have a caveman type diet and lifestyle, and unfortunately we are not living in that environment. We are very much moved on kind of thing, and our body's still catching up, and that's why we end up having all these diseases.
This is true, and statistically, I didn't mention it under risks, and a risk for me, statistically, having your children, a woman having her children later in life, or having fewer children or none at all, that statistically increases your risk of breast cancer. Which is, as you say, it's we're not living in the way we're not living in the way we lived as cave people, I guess. So our bodies are reacting differently.
And in your opinion, Ravi and Claire, what sort of hurdles you have seen to patients or the carers in terms of cancer care and dignity of those who want to get the right care? Claire, Ravi, first you.
I'll be honest, I haven't been in the care sector myself for a very long time, but maybe if I'm going to talk about experiences I've had over in the mental health side of things and health in general, there was always, for me, I think it was choice a lot of the time, but that's going at least 7 to 8 years back. A lot of things have come a long way now, and a lot of things have changed, and I do agree on the way we live in, maybe it's a bit more, it's differently. But it also comes, for me, from my experience, it also comes to choice, maybe from your sort of background, and you might prefer different things and you might need different things that might not be available. But as it stands now, I'll be honest with you, I haven't had that experience. So I don't want to speak on something that I don't want to give the wrong information to everybody.
That's fair enough. Claire?
Sorry, can you just repeat?
I said, in your, what sort of experience you have had in terms, because you said your mum was, you were a carer of your mum who was a breast cancer survivor. She was a breast cancer survivor, right?
Yes.
So, in your opinion, and what sort of hurdles you have seen in terms of the dignity for those kind of people and the carers as well?
Okay, so this is quite a unique, an individual personal experience, and I'm going to share this with you. One of the things that I had to battle with to preserve my mum's dignity and to get the correct support from my mum was it was me battling with a postcode war. In terms of my mum lived within Central Beds, but her doctor's surgery was within Luton. Now, Luton GP practice was saying that it should be district nurses from Central Beds coming out to provide my mum with her care, and this was changing the dressings. She was going through chemotherapy, she had radiotherapy, and anyone that's gone through that treatment knows that it's a very harsh treatment. And as I said to Elizabeth earlier, that it's quite invasive treatment as well. So, like my mum's on her chest, the skin was kind of peeling off. It was kind of burning, and she had to have her dressings changed every day. But what it came down to is because of this postcode issue, district nurses from Luton wouldn't come out because they were saying it was Central Beds. Central Beds wouldn't come out because they were saying it was a Luton surgery that my mum's under, and therefore my mum's care was quite neglected and nobody was coming out. So in the end, I actually I used to go to all the appointments with my mum anyway, and I was like her carer through this situation, and I actually took over part of the care in looking after her and changing her dressings and everything. So for me, I was very conscious of my relationship with my mum, and I've now entered into a different role. And so it was, about sitting down and having a good conversation with my mum, talking to her about what is her choices, is she happy, what kind of are her preferences, and how do we look after her and maintain her dignity and her respect, because it's quite difficult when I'm a daughter and I'm now taking on the role of a carer, and my mum was like, really happy for me to take on that role. But again, it is quite a difficult situation. So you have to think about your role and getting the right care and support, having choices, preferences, and putting that into place. So, and it's also about finding out as much information as you possibly can.
Yeah, definitely. And I must say, wow, the time has passed really quickly. When I come back, we will talk more about the signs and symptoms, and especially which one is the dangerous one among themselves. So stay tuned. We will be right back after these short messages.
You're listening to an Inspire FM podcast, making available our popular programs from our daily broadcast on Inspire FM.
Assalamu alaikum and good evening to all our listeners and viewers. I'm Fahad Matin, your host for today's evening, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. This program is broadcasting live from the studios of Inspire FM today on 31st of January 2019, and we are talking about cancer awareness. With our guests today in the studios, and they are Elizabeth Bailey, Claire Copleston, and Ragida. I always messed up your name, Rugi. That's why I always call you Riri.
Call me Riri.
So, before we went on break, we were talking about personal experience in cancers, and sometimes these are the main things which do gel us in those ways, which is really hard to understand and identify. But definitely, I do like to involve our listeners in this whole discussion, because listeners are our main voice in many different ways. So, listeners, if you have any questions or queries regarding our show tonight, please give us a call on 01582 481822. I repeat, 01582 481822. You can send your questions by text messages or WhatsApp on 0779 481822. I repeat, 0779 481822. So, before we went on break, we were talking to Claire about her experience. But before I start the show, let me ask our guest to give a quick round of introduction about themselves, so at least the listeners who just joined in now after the break know who are the guests. So let's start with you, Elizabeth.
I'll do it very quickly because I did it before. So I'm Elizabeth Bailey from Luton Borough Council Public Health Team, where one of my specialist areas is cancer education, and I'm also an ambassador for the charity Cancer Research UK, and I'm a cancer survivor.
Okay, Claire.
I'm Claire Copleston. I'm a director at Meaningful Education and the founder of the Bedfordshire Dignity Network.
And lastly, but not leastly,
I'll do it for you, Fahad. My name's Ragata and I'm also a director at Meaningful Education and also one of the founders for the Bedfordshire Dignity Network.
Regatta, Riri. Yes, definitely. So let's start with you, Riri, because you said you do have experience in mental health. Now, one of the problems, and while we were on break, we were discussing this very lively, that one of the problems of a person who's been diagnosed with cancer is that the first time a person hear that they have cancer, the first thing hit is the problem they face is the mental health of that particular patient, because the person goes there in depression mode and in confusion mode, and you have seen quite a lot of people suffering with those kind of people in these situations. So what's the best route for them? What's the best thing to do?
I think I personally, from my experience, I feel it's the acceptance of it first. Accepting the news that's been given to you, or if you've just been diagnosed with something, whether it's cancer or anything else, once you're at the doctor, it's accepting that that's happened. It takes a while for that to sink in, and I've seen it go from denial to depression really quickly. And it's almost keeping someone around you who you can speak to, because every now and then you'll probably have questions, or every now and then you'll have thoughts that come to your mind where you think to yourself, why am I thinking this, or what am I going through? And you can go through things that you don't even know you're going through until sometime after, even a few months after, and you think, because I've been told this, or because I've been diagnosed with this, now I'm suffering from depression from it, but you probably won't pick up on it until afterwards.
Yes, once we pass the denial state of mind. Indeed. And wow, I do have a couple of questions popped on my screen, which is really nice. Okay, let's see. The first, it's a comment. Assalamu alaikum, great show and the guest. I had cervical screening test at my surgery. It only take 10 minutes, and the nurse was very friendly and helpful. Thank you so much, sister, for sharing your experience. And yes, as Elizabeth said earlier, that these tests won't take long.
No, I mean, I know people are very nervous about things like the cervical screening test, but for most people, they aren't anything more than mildly uncomfortable at the most. And for a lot of people, they won't be particularly uncomfortable at all. And it really is worth bearing in mind that it can save your life. And if you do have a diagnosis of cervical cancer, you will obviously have to undergo a lot of intimate examinations. So you're not avoiding anything. You need, it's in your interest to do the screening first off. It really is.
Mm-hmm. Mm-hmm. And it is very, very important, especially because sometimes without doing those knowledge, you cannot. And with cancer, especially, it's better to catch it as early as possible, because
you have far more treatment options. I mean, that's the whole point of diagnosing things early. It's to increase your treatment options. And obviously, if the cancer spreads and it goes outside to lymph nodes and other parts of the body, then it can reach a point where you can at best you can manage it. Mm-hmm. Once cancer's reached what we call stage 4 and it's spread to other parts of the body, to all intents and purposes, it's not curable.
Now, this is a common question which most of the people have asked me one way or another, and that was the different stages of cancer. So how do we understand which stage of cancer is what?
Well, we have a system called grading and staging. So the grading is about the type of cancer and really how aggressive it is. And the staging is the level it's gone around your body. So stage 1 is very local. Stage 2 is local but has grown a bit more, so for example, a breast cancer. Stage 3 is when it goes into your lymph nodes, lymphatic system, so it's primed and ready to go around your body. And stage 4 is when it has got to other parts of your body. And when it has reached stage 4, obviously at each of these stages, the lower the stage, the more opportunity clinicians have to cure it, basically. Once it's got to stage 4, it's most likely that they'll be managing it. And to be fair, in some parts of the body, it can be managed for a long time. And a classic example is breast cancer that spread to the bones. And breast cancer that spread to the bones is not the same as bone cancer. It's still breast cancer. It's in your bones. That can be managed for many decades successfully. And I've got friends who have lived with that for a long time. But if it goes to somewhere like your liver or your brain, it can be a lot more difficult to manage.
One of the other questions which pop on the screen says, Assalamu alaikum, does second-hand smoking increase the risk of cancer?
It totally does. So does third-hand smoking. Second-hand smoking, possibly listeners won't remember this person, but when I grew up in the 70s, there used to be an entertainer called Roy Castle, and he's a classic example of somebody who died of lung cancer from second-hand smoking, because he was an entertainer in old-fashioned working men's clubs in the 1970s. It's very, very dangerous. I mean, I campaign, and so do we in the public health team, to limit even smoking outdoors in public areas, like around the Mall and around the university, because yes, it's very dangerous. It is very dangerous.
You said third hand. What's a third hand?
Third hand smoking. Yeah, cigarette smoke. It's not the nicotine, but it's the products of burning, and they are very dangerous. And there's about 200 toxic chemicals in cigarette smoke, and if they're clinging to the walls or furniture, they're still toxic. It's still nasty stuff. I think still cause you damage.
So people,
not nice.
People who smoke inside the car are complete no-no.
Well, people who smoke inside the car when they're children, they're breaking the law. Sorry, I'm getting a bit cross about this.
No, please.
People who smoke inside the car on their own and with adult passengers are doing damage to themselves and their passengers. So it's really not advised.
And definitely, you are, although you are not smoking at that particular time, but you're leaving that residue in the car.
Yeah, I grew up in Liverpool in the 1970s, and you used to be able to smoke on the bus, or in all kinds of public buildings, and everywhere used to have a yellow coating of nicotine all over the place. It was quite astonishing. Younger people probably won't remember this, but you would go into even somewhere like a library, and there'd be a yellow coating all over the walls. It was quite extraordinary.
Yeah, I must say, sometimes if I go outside the countries, and you see some of the countries where people are smoking inside the airport terminals, you will say, "Whoa!"
It's absolutely true. But at the university, we have a lot of overseas students, people coming from places like Pakistan and West Africa, or not the West Africa, I mean Pakistan, that's a country that still has a lot of smoking, doesn't it? And so students from that country come here, and they still smoke a lot outside the building. They're in the habit of doing it.
Yeah, because that's one of their way of socializing.
Yeah.
But anyhow... In terms of prevention, so when we talk about prevention, we talk about recurrence as well. So recurrence of prevention. As you Elizabeth, are one of the survivor, and Claire, you are the carer of a survivor. So in both of your opinion, what are the best things to do to make sure that recurrence don't happen?
This is quite a difficult thing, because you can't guarantee to prevent a recurrence of cancer. And it's important you say this, because what is really important is people aren't blamed for their cancer. Because you never ever know what causes an individual cancer. Even if somebody has lung cancer, you can't say with 100% certainty that was caused by their smoking, because some aren't. And that's a really important point to make. Having said that, we know statistically you can reduce the risk of recurrence of things like breast cancer by keeping your weight down, and generally practicing good lifestyle factors. But really, if your cancer does come back, it's not the fault of you for the way you've acted. All you can do is try to reduce risk.
Indeed.
I think, what Elizabeth said is absolutely right. But I also think, it's about your lifestyle. If you can look after your well-being, eating right, monitoring your weight, attending your appointments and your regular checkups is really important.
Sure.
And also as well, I know this isn't a reoccurrence, but prevention. As a mum, I myself am a mum, and I'm also a daughter. Now, my mum had breast cancer, my aunt had breast cancer, so that kind of rings alarm bells for me. Am I going to get it? Is it in the genes? And I've got a daughter, and I want to think about her as well. So I think, it does kind of make you pay more attention to your own health, and you're more aware of it. And going back to what we was talking about earlier with the cervical smear tests and things like that, back in my younger day, I didn't pay attention enough to going for these smear tests. And it wasn't until one day I read the Jade Goody book.
Yeah.
And that really hit home for me, the importance of going for these tests. I mean, that book is phenomenal. If you haven't read it, it's a must to read.
Her experience had a huge effect on the screening figures.
Yeah, and it really kind of boosted people to go and get checked.
Hugely boosted. Unfortunately, it's gone right down again, and we're actually having a new campaign in March, a national campaign.
Oh, fantastic! Yeah.
Can I ask a question?
Yeah, sure.
I don't know, because there might be a lot of people who I've had conversations in the past about this, but is there certain criteria that you need to meet in order to go? Is it the smear test?
Yeah.
To have the smear test.
Well, currently, you can't have one under the regular screening system before you're 25.
Okay.
Now, a lot of people have a problem with this.
Yeah.
Because, sorry, my voice is going again. Obviously, in some communities, women are sexually active. Women and men are sexually active younger. And you can be almost a decade of exposure before you get screening. So there is a debate in the House of Commons next week, I believe, about lowering the screening age. Personally, I support the lowering of the screening age, but that's a personal, subjective view. For those reasons, we have people in we have a very mixed community in Luton. For example, in the Roma community, people are often, that part of their life starts young, and it's really important they have the HPV vaccine and they have the screening.
Minimum, yes, indeed. And one of the main criteria is that you need to be a female. I cannot.
Excuse me.
And that's one of the reasons I've kept the cameras close to my side, because it's really.
Can I put one more thing out there?
Yeah, sure, please.
Because as a lot of you may know, shisha smoking is is very, very famous, and it's something everybody probably does on a regular basis, if not daily, as a social thing. But I don't think people understand the implications, not implications, but the dangers of it as much as I wouldn't know. So that's why I'm asking, is it something? Sorry, Fahad, I'm doing kind of your job for you. But I'm just thinking of it more of a perspective of, because it's an everyday thing and people use it a lot. It's a daily social aspect where people are, smoking shisha nearly every single day.
Yeah, we say, to having a shisha pipe is like having multiple cigarettes. I mean, tens of the things. Sorry, I'm not an expert on
No, it's just.
But I know that we basically warn people against taking tobacco through shisha. We do say that vaping is an awful lot safer than smoking, and we encourage people who are smoking addicts to take up vaping instead. We wouldn't encourage anybody who's a non-smoker to take up vaping, but if you do have a nicotine addiction, vaping can be a great way of cutting down. I would say generally about things like shishas, you don't often know what's in them.
Okay.
And if you're exposing your lungs to any number of chemicals, there's a lot of potential hazards there.
And no, you are absolutely right, because vaping, the way vaping has been introduced and been told about it for everyone, is that it's a gap stop for people who are really addict. And there are people I know still in this day and age smoke 20 to 30 cigarettes a day, and I absolutely understand. I don't manage to understand why somebody managed to smoke that many cigarettes a day, but there are people still there, and for them vaping is the best option, because nicotine gums or nicotine patches may not able to give them the right number of satisfaction, because they are in a habit, and some people say it reduces the stress levels, and it's not the cigarette which reduces the stress level, it's the taking of air from the nose and mouth and breathing it in and then releasing it out back into the air, as one of my ex-guests says, that's the main reason which helps you to relax. But it is what it is, and that's what the main case, isn't it?
Nicotine's very, very addictive. It's very it's sort of amongst addictive substances, it's second only to heroin.
Right. In terms of screening program, what what's people's opinion about screening program for themselves and for their carers. So let me ask Elizabeth from themselves part, and let me ask Claire and Revi from the carers point of view.
Sorry, Fahad, I'm interrupting you. We did a survey in Luton last year on people's attitudes towards screening. We want to do more work because we didn't feel we really crossed as much of the community as we'd like, but we did get information about what people's barriers were, and they were things like fear, embarrassment, body taboo, right across to daft reasons like I can't seem to get an appointment, or I can't get an appointment when I'm working, and we know that generally less well-off people are less inclined to get cancer screening, which is interesting. And that might be because if you're working more, or you've got less time on your hands, it's more difficult to get an appointment.
And in terms of the carers, what do you think about it?
Barriers to being screened?
Yeah.
I think sometimes...
from the board dignity part and
Yeah, I think sometimes a barrier can be the impact it has on your dignity. And I also think sometimes it's fear. I know that with my mum, she had a lot of fear and anxiety about, going and getting treatment. And it's knowing, once you get into that cycle of treatment as well, what's coming. Do you know what I mean? So that she got into like a cycle where she would get quite anxious about it. So that became quite a barrier. So, I had to make sure there was a lot of support for her at that time. But again, I think, with my mum and even with myself, sometimes the barriers are how it impacts on our dignity and our privacy, and we're put into a very vulnerable situation, and we don't always want to be in that vulnerable situation. So sometimes it is about how it impacts on our dignity, but it's about just kind of reflecting and knowing that these things are for your best interest, and it is to look after your health and your well-being.
Indeed. And while we're on the topic of dignity, Revi, can you tell us about the event which is happening tomorrow?
I can, and I can give you more information on it as well. Tomorrow, it's as people would be aware, hopefully, it's Dignity Action Day, and that's across the whole of the UK. If you go on the National Dignity Council, there is a map and it shows every single event that's going on. So if we've got listeners outside of Bedfordshire, there are many events. Our event is called Connect With Me, and it's a dignity networking event. It's taking place in Houghton Regis tomorrow, and at our offices in Sandringham Drive, which is the Sandringham hub. It will be on from 10 to 1 p.m. and we will have the Disability Resource Centre joining us. Waymaker, they are the first innovators for the dignity cover. Home Instead Luton, Cancer Research, Action Plus Foundation, and Dee Bailey from Simply Dee's. She'll be promoting other things as well while she's there. Hopefully, we might have Ben from the Break a Stigma campaign as well, and a lot of people from the community.
Definitely, because one of these things we do need in abundance is because there are multiple mental health issues happens because of multiple things in our life, like any problem whatsoever we face, any health issues like cancer, like any other long-term condition, diseases, or any stress or mood swings, and we automatically it's a very awkward kind of a tumble down effect, which one thing happens to and that follows to the next one and the next one. And on that note, I must say, wow, we are almost approaching towards the end of our show. So before our show ends, I liked a positive message from each of our guests today. So let's start with you, Elizabeth.
Well, the best message I can give is that since the 1970s, rates of cancer cure have almost doubled, and that's down to research that is funded by the general public. So there's an immense amount of hope out there. A cancer diagnosis is not necessarily a death sentence. Take my word for it, because 9 years later I'm sitting here talking to you.
Wow, 9 years.
Yeah.
Mashallah, mashallah. Sorry, it's definitely a success story, and these are the things which give hopes to people,
Sure.
and relying on to those screening program, and definitely catch it as early as possible
Sure.
to get the survival rate. So how early you got this diagnosed? I know I'm going.
I got diagnosed I was sort of a late stage 2, borderline stage 3, so it was quite a large lump, and it was in 2 or 3 lymph nodes. But that all got taken out, and I feel fine.
Perfect. Thank you so much, Elizabeth. Claire?
I would say that if you're not a Dignity champion, I'd ask why not. So do come along. We've got the Bedfordshire Dignity Network based at Sandringham tomorrow. Come along, find out what it is to be a Dignity champion and how we can preserve people's dignity. And we talk about how we can look at best practice within health and social care. So come along and find out more about how you can get involved.
Riri?
I just want to say that we're really fortunate to be in a country or in a place where we're offered things like the SME test, for example. We get letters come through the door where they say, please come and have a checkup. If you do, just please go and have one.
Yes,
and
definitely.
That's the best thing you can do for yourself.
Definitely, screening program is a must-have, and don't ignore it. And on that note, I must say thank you so much for all our guests to coming to our show today and share their experience and their knowledge. And on that note, I must say, if you have missed any part of this show tonight, don't worry, you can still catch up on Facebook page, or you can go to Facebook Inspire FM website. Our repeat will be played on Sunday at 9 p.m. But until that time, if you have any questions and queries, you can always contact us into the studios, or if you have any questions for our guest, pass those questions to the studio and we can pass it to the guest. Until next week, I'm signing off, saying Assalamu alaikum to all our listeners and viewers.
Thank you for listening to our podcast. Why not tune in to our live stream at inspirefm.org and follow and subscribe to our social media platforms at Inspire FM Luton.